Kogo News Time, 6:42. Well, you wouldn't let your child drink a glass of cognac or smoke a cigarette, so why would you send him out on a football field to risk brain damage? It's a question Dr. Bennett Omalu, a forensic pathologist whose discovery of chronic traumatic encephalopathy was portrayed in the Will Smith film Concussion. He wants parents to consider that. Joining us on the Kogo News Live line is concussion specialist Dr. Sally Fryer Dietz. Good morning, doctor.
Good morning.
So is the doctor that the movie was based on, was he correct?
Was he correct about should your child play?
Right.
Well, I think it gives us something that we really need to discuss. And absolutely, we know that there are injuries that occur with repeated concussions and even subconcussive injuries. So it's something that parents really do need to look at and consider when thinking about what sports their kids should play.
Now, how young do you see kids who suffer from concussions while playing sports?
Well, we see kids of all ages, so we even see little ones who fall off their tricycles. But we see lots of high school athletes. Probably the number one in our clinic is girls soccer. So not just football is it's on its own out there, but any ballistic sport that involves the potential for hitting your head is a high risk sport.
Well, let me ask you this: would you let your own child play football?
Knowing what I know today, I probably would not. I have two boys who are in their 20s, and one played football and one played rugby for for a couple seasons. I wouldn't make that same decision today, just because we know more, and the evidence really shows us that these repeated blows are not good for your head long term.
Is there any safe way to play a contact sport?
I think we need to set our kids and ourselves up for safety by playing by the rules. Avoiding head contact. You want to have a good coach. You need to have good protective equipment. When it comes to football, baseline testing is really important, or any kind of contact sport. Having a good baseline test that looks at everything, both your physical and your emotional and cognitive baseline, so that if you are injured, you have an idea of getting back to that full recovery before you go back out on the field. And that's probably one of the most important things today in case of an injury.
Now, some people say parents should pull their kids out of contact sports until they're at least 18 years old. Would that be something that you would be in favor of?
18 is just an arbitrary number. Your brain doesn't even, in boys, the frontal cortex doesn't fully develop until you're about 30. So what is the right age to make that line? I think 18 is the number that was given because we know that younger children there's more fluid around the brain. So with any kind of an impact, there are more shearing forces that can occur. And the long-term risk and damage is much greater with a younger brain than it is with an older brain.
All right, doctor, thank you for your time. Appreciate it. Dr. Sally Fryer Dietz, a concussion specialist, joining us on the Kogo News Live line.